Hello guys, welcome to Army in White. I'm a fourth year medical student. Here I will be doing important and interesting topic irrespective of any subjects. There will be some funny mnemonics, case history will be dealt, and day-to-day life of a medical student. So let's jump right into the topic. That today we will be talking about the topic from pathology. That is very important. And in pathology, let's look the respiratory pathology. So guys, let's get started. So when we talk about respiratory pathology, the important diseases will be covered here. That will be firstly, let's do pneumothorax. Okay, we all know that pneumothorax, that is any type of gas or air present in the pleural cavity. It's called pneumothorax. Here in the pleural cavity, that is between the lung and the chest wall, that is between these two, there will be a cavity called a pleural cavity, and if there is any type of gas present due to some pathology, that is called pneumothorax. Pneumothorax can lead to total or partial lung collapse. Okay, that will be total or sometimes partial lung collapse. The negative intrapleural pressure should always be maintained. Due to some reason, if the pressure within the cavity is becoming positive, then that's called pneumothorax. So air can enter to the cavity through lung or through the chest wall. From the chest wall, like, it can be due to some trauma, and through the lung, that can be due to some pathology. So there will be different causes of pneumothorax, and there can be spontaneous and that can be traumatic. First of all, let's look. Spontaneous is sudden occurrence without recent trauma. Mark this word: without any recent trauma, there will be sudden occurrence of pneumothorax. That's termed as spontaneous pneumothorax. And in traumatic pneumothorax, from the word itself, it's very clear that there will be some trauma, and that leads to pneumothorax. That is, this pneumothorax occurred due to trauma at chest wall or lung tissues, that can lead to traumatic pneumothorax. But here in this video, we'll be talking about spontaneous pneumothorax. Okay, spontaneous pneumothorax. In the next video, we'll deal with the traumatic pneumothorax. So let's jump into spontaneous pneumothorax. It can be of two types, that is primary and the secondary. Primary spontaneous occur without any underlying lung disease. Okay, this should be understood, that there is no underlying lung disease, and it is idiopathic. But now we know that there will be the causes of primary spontaneous lung disease. And in the spontaneous lung disease, the spontaneous can be due to some underlying lung disease. It can be serious or mild, but there will be always lung disease related to spontaneous pneumothorax. So let's look how are they and what are the causes, what are the things to be understood here in spontaneous pneumothorax. Now, the primary and the secondary. Here in the primary, the characteristic feature of the patient should be young male. It should be young male, tall, thin, and smoker. So when you come across this type of patient, and you can rule out that it can be a primary spontaneous pneumothorax. That is smoker, tall, thin, and young male. Young male means the early 20s or the teenagers. There will be a term called bleb. There will be a bleb, that is pulmonary bleb. The pulmonary bleb are the small air pockets formed here like this, surrounded by the visceral pleura. Okay, that is called the blebs. The air inside the bleb is ruptured, and when this air gets ruptured, example from here, it gets into the cavity. So we all know that the air from the cavity, the air in the cavity due to any pathology or due to any reason is called pneumothorax. So when this when this air gets here in the cavity, it is termed as pneumothorax, and the rupture of this blebs can cause pneumothorax. Okay, and the recurrent rate is very high, because they are after rupturing of one bleb, after a few times another bleb can be ruptured, so another amount of air can be present in the cavity. So the recurrent rate is high, so we need to understand. And we all know that pleural bleb or rupture can release some amount of air and cause pneumothorax. The recurrent rate is high. So another term will be that is will be the pulmonary bulla. Okay, when we come across the word pulmonary bulla, the pulmonary bulla and the pulmonary bleb looks similar, but the difference is here in the pulmonary bulla, the surrounding tissue is the lung parenchyma itself. Okay, see here, it is the lung parenchyma itself. let me make it clear. See, it is surrounded by the lung parenchyma itself like this, but here in the bulla, it is not the lung parenchyma, but it is the visceral layer. Hope this explanation make clear, that is between bulla and the bleb, that is bulla versus bleb. Okay, here in the bulla there will be visceral layer, and here will be pulmonary or lung parenchyma, the surrounding tissue. Okay, so when we come to another topic, that is on the secondary pneumothorax, this is due to pathology. There will be a pathology in secondary. There should be always an underlying lung disease, might be mild or serious. Okay, here in the secondary pneumothorax, pathology in the pleural air space or pulmonary air space, we can say. So when there is any pathology here in the air space, pulmonary air space, due to there will be air space, means there will be air inside these pockets. So due to pathology, this air can be leaked out like this. Once the air leaked out, it can go to the cavity through this pleural layer or through the mediastinum. Okay, through the mediastinum it can go through the parietal layer, and if it go through the pleural layer, it can go through the visceral layer, and there will be presence of air in the cavity. It can cause pneumothorax. Underlying causes can be almost all lung diseases, but most common will be the obstructive lung diseases. The obstructive lung diseases are COPDs, that is the emphysema and the chronic bronchitis, asthma, and the bronchiectasis. These can lead to secondary pneumothorax. Okay, so let's look one more time. That is, spontaneous pneumothorax are of two types, primary and the secondary. Secondary needs some type of serious or mild lung diseases, but in primary spontaneous pneumothorax there will be no underlying lung diseases, but due to the rupture of those bleb here, it can lead to primary spontaneous pneumothorax. And the characteristic feature of the patient is young, male, tall, thin, and smoker. The recurrent rate is very high. Here in the secondary, there must be always underlying lung diseases, that can be COPD, that is emphysema and the chronic bronchitis, asthma, and the bronchiectasis. So hope this make you clear about the two types of pneumothorax. In the next video we'll be talking about the primary, that is a traumatic pneumothorax, and in series of this video we'll be completing our respiratory pathology. Hope you guys understand, and maybe this video will be helping you understand about the pneumothorax and the respiratory pathology. Please like, share, and subscribe, and stay tuned for the next video. We'll be completing pneumothorax in maybe 1 or 2 videos, and I'll let you know once we are going to the next topic. Thank you guys.